Thank you, Gunther. Next, we have Mark Dredze. Machine learning, natural language processing, speech, intelligent user interfaces and health informatics, enhanced messaging, and multiples of the above.
Hi, everybody. Okay. Wow, okay. I guess no one wanted to interrupt my 7 minutes by replying, so whatever. So I'm a doctor, but not that kind of doctor. I'm a PhD, so my background's in computer science. So I'm coming at this from a very different perspective, and I'm relatively new to this. I've only been doing medically related applications for about a year now, maybe a little more. So I'm going to bring a little bit of a different perspective, and I'm also going to talk not just about disease detection and tracking, but a wider range of things. So I might be the odd person out here, but hopefully it'll be something interesting. And what I wanted to do was, in the 6 minutes I have left, to tell you a little bit about a study we did over the past year on Twitter. And we went into this very naive. Again, we're not physicians or medically trained people. And our question was simply, what in Twitter might be useful for health? That was it. That was the question our entirety. So a lot of people here would, if I had asked that question, say, well, disease surveillance, and we didn't even know if that was a possible answer. So we went into this very naively. I don't want to tell you much about the methods we used, but the characteristic of the methods were that they didn't have preconceptions about what we would find. The methods were trained to find diseases, although the methods got to discover what diseases were. So, for example, we told our algorithms that a disease will have certain words that describe that disease, and we don't know what those words are. They'll have symptoms, and here's 10,000 possible symptoms a disease might have. And here are known treatments, and these range from things like Advil to chicken soup, and here's another 10,000 things. We just download those from the web. And we asked our algorithm, go off and find things that you think are diseases just based on what people say in Twitter. And then it came back with groups of messages. And we looked at those messages, and we said, oh, well, this group here looks like it's about allergies, and this group here looks like it's about cancer. This group looks like it's about the cold. There were 15 things we found. Influenza was one of them, and a couple more up there. So what we wanted to do with those groupings is investigate what information that tells us about health. And that's what I want to talk about for the remaining 5 minutes I have. So just a couple things you need to know about the data. This was from, we had 2 billion messages over a year and a half. So April 2009, October 2012. Of that, we found about 1.5 million messages were talking about health-related stuff, and we found those automatically. And of those 1.5 million, we were able to locate 200,000 using some really simple geolocation techniques. Now we would be able to do a lot more given the richer Twitter data. So what we found can be broken down into 3 different categories that I want to talk about. One is behavioral risk factors. The second is disease surveillance, and there's a geographic twist to it. And the third is looking at patterns of symptoms and medications. So I'm going to give 1 or 2 examples about each of these. So what do I mean by risk factors? So as some of you know, the CDC has this behavioral risk factor survey they do every year. They contact about 1/3 Americans, and they ask them lots of questions about asthma and obesity and access to health care and heart attacks and all these different things. We said, well, maybe we can detect similar things just based on Twitter messages. So what we did is we identified Twitter messages by ailment or by disease. We'll call it ailment. And we tried to look at correlations between ailment rates per state and rates per state of different behavioral risk factors that we got from the CDC. And we got something like this. So let me point out a couple examples. So one of the questions that were asked in the survey was, do you suffer from asthma? And one of the things we found were there were a lot of tweets that seemed to be about allergies. Allergies and asthma related. I know this because my allergist also treats asthma, so that's where I got the idea from. We looked at the correlations over states, and we got a correlation of 0.241. So that's an example. So I kind of just put on this slide some of the more interesting ones. States that people exercised a lot were negatively correlated with states where people said anything about disease. Okay? So just the rates at which states tweeted about disease went down if those states exercised more. Healthcare coverage also. States with better healthcare coverage, right? So this is access to healthcare. That made talking about disease go down on Twitter. We also saw things like our obesity rate was correlated with the obesity rate from the survey and other things. So that's risk factors. Next, I want to talk about surveillance, specifically disease surveillance. So we just had a talk about using Google flu trends and the precursor to Google flu trends, which I do cite, so don't worry. And I found it, and I was very excited. I'm like, this is before the Google paper. Does anyone know about this? Anyway, so we wanted to just see, can we do the same thing with Twitter, right? It's pretty straightforward. And we were able to ask our model, statistical model, tell us what the probability of people talking about the flu was each week over the course of our data, and we can compare this with CDC data. So Twitter line is in blue, CDC line is dashed. It looks to be correlated, and if we look at a correlation coefficient, it appears to be correlated. This is about the same correlation number that Google gets. And we actually correlated Twitter with Google, and the correlation's a little bit lower, but not that much lower. But we wanted to do something a little more interesting. So we wanted to do something where it wasn't just by time, but we also wanted to do something by location. Remember, we had geolocated some of our data. So we decided to look at seasonal allergies, right, which vary not just by time, but they also vary by location because different states start allergy season at different times, and different states suffer from allergy season in different ways. So I just want to show you one snapshot. We have a lot of maps that look like this. This is from April 2010. Darker colors mean more people are tweeting about allergies. And this is not at all surprising. So you'll take my word for it, compared to February, this map is a lot darker. There's a lot more people talking about allergies in February. And you can see that the allergy talk is primarily in the Midwest and Northeast. And if you look at February, for example, the primary allergy talk is in the South and the West, which are warmer states. They start allergy season earlier. So we thought that was kind of cool. This suggests that we really can use location information to do things with disease tracking and just tracking in general of other things. The last thing we looked at that I want to mention is we looked at symptoms and treatments, and I just wanted to show you here one of the treatments we looked at. So we wanted to see how people were using different medications. So we picked a couple of well-known allergy medications, and we tried to say how these were correlated with messages in different diseases. So for example, we have messages that talk about allergies, and we have messages that talk about influenza, insomnia, colds, headaches, all these different things. And we said, of the messages that mention Benadryl, what percentage of them are each one of those other diseases, right? So Benadryl shows up mostly with allergies. It's not really a surprise. But it also shows up a lot with what we call skin ailments, which if you look at them are things like skin rashes, so non-seasonal allergies, so not really a surprise there. And also insomnia. There's a lot of people who use Benadryl to fall asleep at night. And we were able to pick that up in the Twitter data. So I think that's particularly interesting because I know Benadryl knows that it's a helpful way to fall asleep at night, but maybe that's not the recommended use. I'm not really sure. Again, I'm not a doctor. But it's really interesting that we can detect maybe these unintended uses or these self-medicating creative uses of medications from Twitter data. Particularly interesting because if your doctor asks you, you don't take Benadryl to fall asleep at night sometimes, do you? A lot of people are going to say, well, no, of course not. And if you get called to do a phone survey, you might say no, but you're going to tell all your friends on Twitter that for whatever reason. And then we saw things like Claritin and Zyrtec were much more specialized. People use those just to treat allergies. Sudafed, people use to treat all different sorts of things. It's because Sudafed's a little like Tylenol. You can go to the store and buy Sudafed for anything these days. So I wrap it up. Yeah, how about that? So these were just some examples of what we found. Obviously, disease surveillance and disease detection is one aspect of this, but what I want to just argue for in one sentence is Twitter is an incredibly rich source of information, and I don't think we've reached anywhere close to the limit of what sort of health and medical information we can derive from Twitter. Thank you.